Okay, I see all the logins coming through. Thank you for joining us tonight. Okay. Perfect. So we're at 8 o'clock. We're 8:01. So we like to be on time because we have a 2-hour event tonight, 1 hour COPE, 2-hour event. So good evening, everyone. Thank you for joining me tonight with this 3-part webinar. My name is Dr. Neda Gioia. I'm the president of the Ocular Wellness and Nutrition Society, and I will be hosting this 3-part series tonight. We have an in-depth session with Dr. Liz Lipski, where we'll explore evidence-based lifestyle integrations for overall health and systemic health and eye health, of course. And we'll hear from Amy Smith and Alyssa Doherty from the ANA. And then to top it off, we will have full scripts here to offer some valuable insights out as to how to grow your practice and boost revenue. Remember, the first hour is the COPA proof section. So to be fully clear, part 2 and 3 are not a part of the COPE presentation. So your certificates after today's event will be emailed to you directly with the survey within about 1 to 2 days. So please do not ignore that email. Also, emphasis on the Q&A, and the reason is that we will have a Q&A specifically for Dr. Lipski right after her presentation. So use the Q&A button, not the chat, please. And it's really exciting because we have had a few webinars. So if you don't know about our society, just a quick brief overview. We are a 501c3 nonprofit education organization. Really, our growth is by your contributions, our industry supporters, volunteers, and really the membership. So if you aren't a member, please become one now. We have some perks that might really be great for you. One is to connect with community and to connect with patients with our Find a Practitioner. We have a wonderful discount with the American Nutrition Association, which we will go in depth with in a few minutes after Dr. Liz Lipski's presentation. And then last, we start other initiatives. So right now, we just kind of kickstarted our ambassador program. That I did about a week ago with our ambassador chair, Erin. So we have a lot going on really to push that nutrition and lifestyle medicine are a need for our healthcare system, not even our eye care. We really need to start thinking this way because unfortunately, too many of our population are sick with things that can be mitigated. We offer webinars. We have a webinar that's specific for our members coming up next month with our founder and past president, Dr. Jeffrey Anschel, and it's about nutritional support for glaucoma management. So this is one other perk that we do offer. Some of our subject matters are really unique, and I do really take pride that OWNS finds the future of how to integrate nutrition into eye care. And it just doesn't stop this year. We have an in-person meeting at our annual reception at Academy. Our initiatives are just wonderful this year. We're thrilled to announce this in-person reception. RSVPs are now open. You could sign up through our homepage or your membership benefits section. This year, we're celebrating an incredible milestone, 6 new fellows. That's the highest number of fellows in 1 year. And we're awarding a $1,000 student poster prize. So we're going to have a whole little thing for our students alongside all of these awards. So save the date. If you cannot attend to the entire event, we encourage you to join us when you can. And our agenda will be up and running in the next week. We've announced a lot of things these last few days or week, so we're trying to pace ourselves. So I'm honored to present Dr. Liz Lipski. I was actually watching her all weekend on my nutrition webinars. So I'm happy to hear her voice again. She is a pioneer in nutrition and digestive health. She's worked as a clinician, an educator, an author, an advocate, a researcher. She implemented the first 2 doctoral programs in integrative and functional nutrition in the US. She's a leader in so many aspects. She holds a Ph.D. in clinical nutrition, 2 board certifications in nutrition, and she is IFMCP. She serves as a special advisor and sits on several advisory boards, and she has books. She's an author of Digestive Wellness, Digestive Wellness for Children, which is such a key thing that we need to learn about, and Leaky Gut Syndrome, which I encourage everyone to learn about. So I will kind of conclude my slides and give it off to Dr. Liz. And please use your Q&A button. We will put that towards the end. So Liz, if you want to start transitioning your slides.
Yeah, so thank you, Neda. I'm so glad to be here. And Neda asked me to talk about lifestyle medicine, which made me start thinking about how does it dovetail into ocular health. My disclosures is I'm on the advisory board for Algecal, and I don't really have anything else to disclose here. So I noticed in my emails this week that Owens came out just this week with the 4th edition of their Wellness Essentials, which dovetails so perfectly with what I'm going to talk about tonight. And honestly, I wish I had it as a cheat sheet so that I could have seen some of what was there instead of making this up all on my own. So fun. Our learning objectives are to look at the concept and pillars of lifestyle medicine and introduce how personalized lifestyle medicine differs and functional medicine differ from lifestyle medicine. They're not the same. And then interweaving how ocular health can indicate systemic health issues, and then explore how you can actually use this in your own practices. So let's dive in. And that's Multnomah Falls, which is about half an hour from where I live. I like taking pictures. So this was from Robert Kushner and Kirsten Webb in 2013. And what they said is unhealthy lifestyle behaviors are at the root of the global burden of non-communicable diseases and account for about 63% of all deaths. Although a healthy lifestyle has repeatedly been shown to improve mortality, the population prevalence of healthy living remains low. And every day I try to live in balance. It's not easy to be in balance. And so how do we do it, and how do we communicate that to our patients? So from the Nurses' Health Study, they just which was one of these huge studies, what they did was they started looking, and they're like, okay, so nurses who never smoked were close to their normal body weight or optimal body weight, exercised about 30 minutes a day, drank moderate alcohol. So for women, a small amount, like half an ounce or less, and for men, about an ounce of alcohol a day, and had better diets, lived longer, and they had less diabetes, cardiovascular disease, and cancer. Now, these aren't rocket science. These aren't, like amazingly difficult lifestyle habits to pursue, and they can really help. So let's talk about health optimization, because when I'm working with somebody, I'm always looking for, okay, you're starting here, but where can we get you to in terms of actually feeling better than you feel? And how much better can you feel? And making small changes in lifestyle can really help people do that. And then also let's start looking at the sense of meaning and purpose and gratitude and reflection. So, for me, one of my meanings and purpose has been, how do I grow? Like, my life mission for the last 25 years or so, maybe a little more, has been, how do I help grow the field of personalized and functional nutrition? How do I sit on those boards? How do I do the legislative stuff? How do I make the educational programs? How do I teach at conferences that train professionals to do that? So that's a lot about my meaning. I also have meaning in my family and the people that I love. I also find meaning in my garden. So I have lots of ways that I look for meaning and that I have meaning in my life. And that helps me make healthier choices, but it also helps me kind of have a purpose to get out of bed in the morning. Like, what do I really want to do? So the positive effects of having a meaning translate in the literature to better lifestyle choices. People who have a sense of purpose, a sense of meaning, are more proactive about their health testings and screenings. They're more likely to exercise more, pay more attention to their food, sleep better. They have better immune function. They cope with challenges more easily, especially if they have good support systems. Research shows that cortisol levels are lower and that there's increased resilience. And that's what we want. Dr. Gioia was just talking about like a lot's going on in her life. But when we have that resiliency, then we're more like rubber and we can kind of bend a little bit more easily. And we have that ability to not kind of get so off center from every little thing. Research also shows better cognitive function and less functional decline, including less Alzheimer's and mental cognitive impairments. So, this is all just having a sense of meaning. And so I'm asking you, kind of, where do you find your meaning and purpose in your life? You can put it in the chat box, in the Q&A box if you'd like. And do you have a personal or professional mission? Is there something, that's really important to you and it's essential to your life? And what motivates you to get out of bed in the morning? What's exciting to you? What keeps you charged? Because this sense of meaning and purpose is really important. And here's some references and resources for you to kind of use with your own patients and also to check out yourself about kind of what people's purpose is. It's like, what is your why? Like, Dr. David Rakel, he was interviewing a patient who said to him, I have a bum knee and it's really important to me to be able to sit and play with my grandchildren on the floor. And he said, okay, let's march over to the PT department and let's get you started on PT right away. Because if that's, the life purpose right now that's right in front of you, let's just get right on it. And so what's your why? What do you want your health for? What do you want your life for? And these are resources that help you to look at that. The next principle of lifestyle medicine is healthful food. Eat a rainbow of food, eat a lot of plants, and focus on a Mediterranean type diet. And in the wellness report that Owens just put out, you'll see that there's handouts on how that you can give to patients on how to do a Mediterranean diet. So let's kind of look at this health continuum. And this is really, excuse me, this is really a lot about kind of that health optimization as well. It's like, okay, well, we can feel fine, or we can feel good, or we can feel like we're optimally well and really healthy and vibrant every day, or we can feel like we're not in poor health at the moment, or we might have diagnosed diseases. And we might have diagnosed diseases, but still feel like we're managing them optimally and we're in great health despite having a diagnosed disease or two. So where are you on the continuum? And I'm always trying to move people over. Now, when we look at nutrients, there's about 150 key nutrients, including micronutrients, macronutrients, some nutrients like CoQ10 that aren't really classified as a vitamin or a mineral or a micronutrient, really. And then in food, there's 26,000 bioactive food components. And we're just starting to look at those. Barassi wrote a great paper on this. And there's a whole field called food omics. Like, what happens when we eat broccoli or ginger, or we put, excuse me, kale or ginger or fresh turmeric or dried turmeric or berries into a smoothie in the morning, or we have a salad that has 15 different kinds of vegetables in it. What happens to our gene expression? What happens to our microbiome? What's the conversation that's happening? Um, and, when we start looking at this on the left side, we've got, kind of the basic nutrients, protein, amino acids, fat, carbohydrate, fiber, vitamins, mineral, water, phytonutrients, and accessory nutrients. But so much of this is in kind of what we eat. And when we start looking at the studied nutrients for ocular health, whoa. So I just started looking at some of the research on kind of nutrients for ocular health. And I think nutrients in the age-related eye disease study, the AREDS, probably some of you already have AREDS 2 or equivalents in your office that you're selling. And that's really great because the studies on AREDS and AREDS 2 have been very promising about protection of vision and protection of ocular health. And we have some studied supplements, the AREDS 2, the Div Phos, if I'm mispronouncing that, sorry, Vitalux Forte, just lutein and zeaxanthin supplements, and Nutrof Omega. Other studied nutrients, there's so many of them, and I'm going to highlight just a couple. And then there's protective foods as well. And when we look at the protective foods, wow, they look a lot like a Mediterranean diet. And so, eating real foods is key. Vision and vitamin D, I kind of pulled this up this morning and was kind of looking. So vitamin D deficiency may be linked to cataracts. It also may prevent macular degeneration. So one test that you can be running in your office as kind of a screening test would be a vitamin D levels, 25 OHD, and looking for people having, 50 to 80 nanograms per milliliter per milliliter of vitamin D. People who are nearsighted have lower levels of vitamin D, and it can also help with tear function and help reduce risk of glaucoma. Also, vitamin A, I think of vitamin A as giving like the eyes a bath. It helps the retina convert light into visual signals. It's a component of rhodopsin. It's the cornea. It helps the eyes produce moisture to keep the cornea lubricated. And without enough vitamin A, cornea can become dry and damaged. And then it helps the conjunctiva. And so, so much, I have a whole lecture called Vitamin A Can't Get No Respect, a la Rodney Dangerfield, if you're old enough to know who he was. But vitamin A, it's kind of maligned, but students of mine at the doctoral level wrote a paper looking at vitamin A levels, and vitamin A is so important for mucous membranes, including the gut. It's important for immune health. It's important for leaky gut, and pretty much for everybody except smokers and pregnant women. 10,000 IU of real retinol, real vitamin A day is healthy. So again, like kind of looking at serum retinol levels can also be a useful test to run. And I'd also look at zinc levels and other. I think doing nutrient testing can be so helpful for you to help people come into that more optimal place. So let's take a look at what Americans are eating. And we are eating kind of horribly. This comes from the USDA. And if you look, this is the percent of the US population who does not meet the basic needs, the basic dietary reference intake for nutrients. And these were set like to prevent beriberi and pellagra, but they weren't set to optimize health. And so when you look at, 68% of the population doesn't get enough magnesium. And you think, okay, well, how many people, like I think about magnesium insufficiency signs and symptoms, constipated, easily irritable, tight muscles, little eyelid twitches. People come in and say, my eyelids twitching, think magnesium. people who are really sensitive to noise, people who have like these little pings that they're like a nerve just kind of setting off, or sometimes with real severe magnesium deficiency, people can feel like there's a pressure in their chest. So that's just one nutrient, and each nutrient is so critically important because we use it for specifically, if we don't have enough, we die. And when we look at the B vitamins that are in here, riboflavin 20, almost 22%, people aren't getting enough. B6, 35%, B12, almost 30%. When we look at the Bs, they really help with mood and energy, and how many people are tired and they're anxious or depressed or have some other kind of issue. We're just not getting enough in our food. I'm not going to spend a lot of time in this because you'll have the slides, but also when we look at kind of what people are eating, we're not eating enough fruits and vegetables and whole grains. We're just not doing that. So what do Americans eat? Over half of what adult Americans eat is ultra-processed food. It's the stuff at the top of the screen. And the stuff at the bottom of the screen, well, people aren't eating that much. It's just pictures I took of a meal that I made and also a farmer's market. So when we look at ultra-processed foods, we have a global classification system called NOVA, and it's 4 levels. So the first level of NOVA is an apple. Today I just went out, my fig tree is producing a lot of figs, so I'm starting to think about what can I do with all the figs, and besides just drying them. Okay, so the figs or apples or eggs, those are class 1 foods. Class 2 foods are the things that we might use to make those taste better. So there are things like butter and salt and pepper and herbs and spices and sugar. And these are the things that make those eggs taste better. And so those are class 2. Class 3 is if I make a salad at home and I slice up some of those figs and then I fry an egg and I put that on top of the salad. Now I've made a class 3 food. Or maybe I made an apple cobbler, or a peach cobbler, or maybe I made a blueberry pie. That's a class 3 food. But the class 4 foods are all the ultra processed foods. Those are the packaged foods that have nutrients stripped out. They're shelf stable for really long periods of time. And what we know is that that the average American, as I said, is eating over half of their foods as these ultra processed foods. I was at the grocery store today and I saw somebody's basket and I was just kind of going, no, please don't take all that stuff home, because it was all sugar and white flour and bad fats, and it was just not really food. So what we know is that if people eat 2 servings a day, 4 servings a day compared to 2, they have a 62% increased risk of early mortality. And for each serving out of over 4, it increases that risk by 18%. Every 10% increase in ultra-processed foods increases our cardiovascular disease, heart disease, and strokes by about 12%, and 11% increased risk of depression. And it also leads to higher visceral fat, obesity, overweight, and then high fructose corn syrup is associated with risk for colorectal cancers and other types of cancers. So, what we see is these ultra processed foods that are comprising half of what people are eating are really not great for us. And then with kids, 67% of what children and teenagers are eating is ultra processed. Why? It's easy. Moms and dads can stick it in a backpack. Kids like it. It's designed to be really tasty, and it's not good for our kids. So food is information, and we need to start thinking about the genomic impact. Like, how does it affect our genes? And again, that's a totally different talk. But we can eat colorful foods. We can eat the foods on the left, or we can eat the chart on the right. They're both colorful, but they have really different effects. And we know that just intuitively. When we start looking at lutein and zeaxanthin, they protect our visual function. And pretty much you're not going to get that much of them in kale or papayas. They need to be gotten from food and or supplements. And so this is one area where your field has really jumped on this bandwagon and is offering these to people. And here's food sources of lutein and zeaxanthin. And again, if we look at this, all of this fits perfectly in a Mediterranean diet. So what is the Mediterranean diet? And when I look at it, there's a couple things that I love about this. This chart came from a dieta mediterranea.com. And at the base of it is regular physical activity, adequate rest, and conviviality. When was the last time you went out with friends and had a meal, or you sat down with family and you ate together? And also at the bottom of this is biodiversity and seasonality. Eat local foods in season, eat traditional and local foods, go to your farmers markets, use eco-friendly products, and cook. I can't tell you how often I would sit with a client and they would look at me like, you want me to what? Cook? No, I can't do that, And so just showing people some little things, doing food demos, having a little kitchen or even a hot plate in your office and offering cooking demos. Invite a nutritionist or somebody who likes to cook, or a chef, somebody who really likes to cook, to do simple things. I have a friend who's a pharmacist, and she does that in her pharmacy. And so, at the base of this is healthful grains and fruits and vegetables. And then we kind of go up, and sweets and red meat and processed meats and potatoes are less. So Mediterranean diet are good for us. And, here are some of the many benefits. Again, I'm not going to read all of this, but interestingly enough, in the Predimed study, which was one of the biggest, they found that the biggest bang for people's buck was olive oil, about 1 liter a week, and nuts and vegetables and fruits and herbs and spices. I certainly don't get 1 liter a week of olive oil, but I do use olive oil pretty much every day, and so it's like, okay, there's a lot of benefits to this diet. And again, when we're looking at non-communicable diseases, this is the diet to really think about. And when I think about it in terms of age-related eye disease, we've got reduced risks of, the more you eat towards a Mediterranean diet, the less diabetic retinopathy, the less macular degeneration, the less late-stage age-related macular degeneration. Dry eyes, mixed studies, but 3 were positive and 1 was negative. The evidence isn't that strong yet for cataracts, glaucoma, and dry eye syndrome. And in a 7-year study, they didn't see really an effect on the need for cataract surgery. So, we still have mixed research, but there's definitely benefits. And then, is the Mediterranean diet really right for everyone? And I start thinking about it and I go, well, what if somebody's from Korea? What does a traditional Korean diet look like? And how can we include more of that in that person's life, and also include Mediterranean diet foods that they like and they're comfortable with? Or if they're from Thailand, or if they're from Niger, or they're from India or Japan, like, how do we start saying, okay, let's look at your traditional diet and let's see what you can incorporate. Because in 2010, I wrote a paper that was published. If you email me or go on my ResearchGate site, you'll be able to download it. And looking at traditional diets, and all the traditional diets are helpful because cultures figure them out over millennia to how to be balanced. So, be flexible about this. And then whole foods diets, 80 to 90% whole, unprocessed, additive free, if possible, organically grown. use the environmental working groups, Clean 15 and Dirty Dozen, because if money's an issue, then people can see, well, what do I really need to buy that's in the organic section? And what can I buy that's just commercially grown because of the pesticide levels on it? Sorry, blueberries and apples and pears and plums are kind of on the Dirty Dozen. Eat whole grains, nuts, seeds, legumes, 7 servings daily of vegetables and fruit. Why did I pick 7? Because at 7, we start getting huge benefits, and most people aren't even getting the recommended 5. Fish, meat, poultry, eggs, dairy, if they agree with you, healthy fats, stay hydrated, and then individualize this, because about 30% of people have some kind of food reaction. And then a lot cook, fresh and homemade. Also add herbs and spices. These are prebiotics. The polyphenols in them feed the microbiome. They also soothe digestion and help with leaky gut. And they also just make our food taste so much better. So then let's look at physical activity and movement. I don't think I have to convince you about this, but what's recommended is at least 150 to 300 minutes of moderate intensity good exercise, plus 2 or more days of strength training each week. And then in adults over 65, it's less, 150 minutes a week, 2 days a week that are for strengthening, and then activities to improve balance. But be as active as you can be, because it's good for us. So how many of us do you think are meeting the guidelines? What do you think? 78% of adults in our culture meet the guidelines, 45% meet the guidelines, 28% meet the guidelines. What do you think? I see a 45, a 28. I also saw don't drink from plastic bottles. Yeah, they're horrible for the environment, and they're horrible for you. We're all just like a sea of microplastics. Okay, we got really smart people. 28% is the consensus, and that's right. And so if less than 1 out of 3 people is exercising, this is something you can be asking people about. Are you exercising? How much exercise do you get? Because it's good for our eyes. It's neuroprotective. It helps with mitochondrial function. It protects our retina. It's good for prevention, and if somebody has glaucoma, and spending time outdoors reduces myopia and nearsightedness. So, just thinking about what can we do. And then looking at the Copenhagen Heart Study, they followed over 19,000 people, and 8,500 were followed for 25 years. And they looked at what kind of exercise are people doing. And what was really interesting was that the people with different types of exercise lived longer. And tennis was the highest at 9.7 years. They didn't include racquetball, but I'm curious about racquetball. And, one of the things that was the most telling about this was the investigators really believed that the activities where people have the highest social connections live the longest. And so, when people are playing tennis or badminton or soccer, they're doing it with other people, and there's this interaction. So there's a whole community that's also involved, or basketball, which they didn't have on here, So kind of looking at, well, what can you do with others? What if you go for a walk with a group or with a friend? Doesn't that increase your life expectancy longer than if you just went by yourself? And probably it does, but we don't have the research on that yet. So let's look at stress management and leisure. What did you do today to chill out a little bit? Maybe this is what you're doing. How do you know when you're stressed? What kind of signs does your body give you? I get really klutzy. I might cut myself or burn myself in the kitchen. What are your signs? How do you relax? On my intake form, I used to have that question, and it was surprising how often people would just write down, I don't. What do you do for fun? How do you connect with others? Do you spend time in nature? What are your hobbies? How resilient do you feel? This is a whole lifetime of work, but starting to think about it. And what can you let go of to ease your life? What can you delegate? Is there somebody you can ask for help? And look to the lifestyle pillars, and then think about do you have a gratitude journal? Do you have a prayer or a meditative practice or a spiritual practice? Do you practice forest bathing? This is a picture from, I think, this year, where we were in the National Redwood Forest, and that's somebody near a tree. Wow. I think that's me near a tree. Anyway, so avoidance of risky substances is the next principle. And this is a picture that I took because I was really struck this summer about, oh, look, they're advertising about the wine, liquor, beer, and cigars, like all the toxins that they're selling at this store. Isn't that really great? So trying to avoid risky substances. According to the Environmental Working Group, the average woman's exposed to about 120 everyday chemicals a day, and the average man about 60 to 70. And chronic ocular pain is a common etiology of chemical exposure from work, usually. Glaucoma is an example where people can have heavy metals or chemicals or air pollution that contributes to the glaucoma. So, again, do you have an intake form that asks people about this? And then there are all sorts of pharmaceuticals that can have negative effects on ocular health and vision. And so, asking people about what medications they take can be really useful. And then sleep. The average American gets less sleep than they need by 1 hour. As adults, we need 7 to 9 hours of sleep a night. I can't tell you how many people have told me that they get 5. Have a consistent schedule, create a routine, stop caffeine after noon or don't use it at all. Alcohol is not the friend of sleep. Sunlight exposure helps us sleep better, so spend some time outside every day. Exercise encourages sleep. For me, when I exercise, if I exercise for an hour, I have an hour more of energy every day. So saying I don't have time is not an excuse, because it gives you time in your day. And then kind of turn off your electronics about an hour before you get to bed, and think about how you can relax once you get into bed. Then we're getting to the bottom of the principles. Social connection, I've mentioned this before. This is a new 2023 government study, our epidemic of loneliness and isolation. And what they say is strong human bonds help with overall health and BMI, cardiovascular disease, dementia, stroke, anxiety, cancer survival, depression, improved mental health, and decreased overall mortality. And about 50% of Americans experience loneliness, and it's highest in young adults. And so, it's like, okay, do you know young adults? Can you bring them into your fold? What can you do? We certainly saw during COVID so much loneliness. And then when we look at vision loss, it's a double-edged sword. As people lose their vision, they feel more and more isolated. There's increased loneliness. There's increased worry, anxiety, and fear if they don't have good support, and about a quarter of people report depression and anxiety. Well, of course, that's, perfectly appropriate, but how can we be aware of this and help ameliorate it? So here are just some questions, and these came from our epidemic of loneliness. And so again, in your questionnaires, or if somebody's losing their vision, these are questions that you can ask. And then with cognitive enhancement, start thinking about, I just kind of pulled this out from various studies about cognitive enhancement and the focus on optimal stimulation. And so, how can you keep your eyes healthy by using them and by giving them good stimulation? And again, forest bathing, spending time in nature, not staring at screens continuously, all these things can really help. So we get to the next learning objective. And so the pillars of lifestyle medicine are really fantastic, but they're not personalized. And so, I'm a nutritionist, I'm a CNS, and I focus on functional medicine and personalized nutrition. How do we do this? And this is the functional medicine tree. And I'm showing it to you because most medicine and even ocular medicine, it's all focused on like, how do we diagnose glaucoma? How do we, like when I go in to see my optometrist, they look and we do, the testing and they're like, oh, your eyes look really great. But nobody ever says, oh, well, here's what you can do to keep them great. And, functional medicine really focuses on, okay, diagnoses are really important and treatment is really important, but that's up in the leaves and the branches of the tree. And this lifestyle medicine is at the bottom. Okay. And that's what holds the tree up. But how it's personalized in functional medicine is you start looking at the mental, spiritual, emotional aspects of the person. You start looking at their genetics. Do they have an ApoE4, which makes them more likely to have Alzheimer's and cardiovascular disease? What are their attitudes like? Was there a trigger, or is there something that they keep doing that makes them less well than they could? And we use also testing to look at this. And so using nutritional testing and other testing can be really so the things that we use are things like we use all of the lifestyle medicine principles, but then we also use a timeline to kind of see, well, how do all these things contribute? I was working with a 28-year-old woman with irritable bowel syndrome, and her irritable bowel syndrome started when she was 12 years old. She was babysitting for a baby who died of sudden infant death while she was babysitting. And she'd had a flu-like episode a few days before that. Well, we know that there's a lot of irritable bowel syndrome that's post-infectious. So my first question was, had she done counseling about this event? And she said, oh, yeah, I did a lot of it. I know it wasn't my fault. I feel okay about it. But a timeline can give you a lot of information about what's really happened in someone's life. It's also systems-based. Everything is connected. So we're looking at hormones. We're looking at nutritional insufficiencies. We're looking at toxic exposures and accumulation and genomic ability to get rid of those toxins. We're looking at stress. We're looking at infection. We're looking at the genetics and epigenetics. We're using a listening partnership to retell someone's story back to them so that it makes sense. Oh, here's how you got in this pickle. Now, here's what we're going to do to help you climb out of this hole that you're in. We have ladders that you can climb and you're going to feel a lot better. But and I'm going to hold your hand. We use supplements and we use testing. And you're going to learn about supplements and testing later. So then you probably already know this, but ocular health affects systemic health issues, which is why, you're seeing cancers and you're seeing cardiovascular disease and other things by looking in the eye, which is so cool. So here are just some textbooks that I pulled up on ocular, manifestations of systemic disease, which I think is pretty cool. It can give you a lot more than I can. And then here, this comes from Betzler, but predicting markers of systemic disease through ophthalmic imaging. So these are things that you can see when you look in the eye. And so, even running some of these blood tests can be helpful, or taking people's blood pressure. You might be the only person who's taken it in a year for somebody, looking at kidney function, looking at for chronic kidney disease, like all of these things, and running some blood tests, just basic labs, if somebody hasn't had them, or looking at their labs can give you even more information and or an ability to refer more easily to a health professional. So ask people about their lives. How can you do this? You know, I know it's hard in the amount of time that you have, but some of your assistants can do some of this. You can also have a really good intake form where with a sleep and exercise and food journal, it's not hard to just kind of look at that and go, okay, you know, you might need some help. And have a nutrition professional on staff or as a referral, you know, or have a coach on staff or as a referral, or a nurse who's really interested in all of this, who can sit down and work with someone. Because I know that as a nutritionist in most states, you can bill for my services, you know, so it's reimbursable and it's another income stream. And same with health coaches. You can also have classes on prevention and slowing down progression of ocular health problems. You can have a macular degeneration group, or you can have a cataract group, or you can have general groups. And again, you know, bring people into your offices more than once or twice a year so that they can come and feel like it's a place where they can connect and learn and improve their health. And then sell specific nutritional supplements. You're going to hear about that, um, you know, and you may want to order lab tests to get more information as well. Because we know, for example, type 2 diabetes and high hemoglobin A1C lead to changes in ocular health that are really damaging and cause blindness, and so does kidney disease. So looking at all that can be really useful. So what we've done is done all of this, and I know that that was really quick, but I wanted to kind of zip through it so that we have time for a discussion and some questions. I hope I've explored the concepts and pillars of lifestyle medicine, introduce you just briefly to how we personalize it, which makes it more effective. I think about 80% of people, if they do the basics, they're going to feel so much better. And then the other 20%, we need to go further. We need to ask more questions. We need to refer out to people who really understand personalizing this. And then talk a little bit about systemic health and eye health, and then explore how you might implement some of this. And here's how to find me. And here's some of my here's all of my books except for one, and my online course. So anyway, I'm going to go ahead and stop my share, and let's see what kind of questions came or comments.
Well, that was an amazing presentation, Dr. Lipski. I know all the subject matters that you brought up are probably lectures within themselves. So, you know, we're just kind of touching the surface here, but it's not so much to be overwhelmed. It's to know that anything you do is helpful, because we're in a population that's getting almost nothing. So don't be overwhelmed, but take some tips and start implementing as soon as you can. And some great tips you gave. I'm going to start some Q&A questions. There was a question about the slides that will be shared, as well as the recording. One question I would like to ask is, what is your take on high dose vitamin A for retinitis pigmentosa, I believe? How much is too much? You said about 10,000 IUs is safe. So any insight on that?
I don't, because it's so far out of my scope of practice. What I would do is, I know that, for example, Jonathan Wright and Alan Gabia, who are two MDs who do a lot of nutritional medicine and teach on nutritional medicine, one of the things that they often will recommend is kind of high dose vitamin A for a short amount of time, maybe even up to 80 or 100,000 units of vitamin A for 3 or 4 days, and then kind of backing down to 10 or 15,000 units a day. And if you're going to do that, then I would do lab testing to make sure somebody's not getting too much vitamin A. And I would probably do that every 6 or 8 weeks, something like that, to just kind of monitor it.
Okay.
Too much vitamin A looks a lot like too little vitamin A. Too little vitamin A, people feel sandy, gritty stuff in their eyes, and too much vitamin A puts you over into sandy, gritty eyes again. So you can kind of look at that as kind of some kind of, little symptom markers of vitamin A insufficiency.
And yes, and there's testing too, potentially, right? So
Yeah.
we test about vitamin A, about
Yeah.
vitamin D serum
And you
level.
want to look at serum retinol levels, not beta carotene levels. And they're both useful, but
Yeah.
you really want to look at the real vitamin A because a lot of people don't convert carotenoids into retinol. And it's the retinol that the eyes really use.
Yes, and that is something that we need to know in eye care, that beta carotene does not equal the same as retinols. There was another question about the dirty dozen. What is that?
Okay. So there's this wonderful group called the Environmental Working Group. They're a nonprofit, and every year they put out a list of the foods that have the highest pesticide residues, and then the foods that have the lowest pesticide residues. And their website is ewg.org. They also have a wonderful site called Skin Deep, which looks at cosmetics and all the stuff that we put on us to clean ourselves and make ourselves more beautiful, and shampoos and all of this. And so when I'm buying, hand lotion, or I'm buying shampoo, or anything, I'm always looking on their lists, and I'm looking for something that they verified as safe. And you can kind of look and make your own decisions, but fragrances are not really healthful for people, and candles and other things. They put phthalates into the air, which are associated with all kinds of health issues. So, looking at, I think they're a really useful group. And if you're not familiar with them, ewg.org.
And we have that in our wellness supplement, actually, as a reference. So another quick question, and I think they meant at ApoE, what is that? So I think you kind of spoke about it very briefly. Obviously, it's a weighted question, but can you briefly discuss what that is?
Sure. ApoE is a gene. What I will say is, when we were in school, we got told, you get these genes do these things. And now the science is really different now that we have mapped out the human genome, and we know we only have like 20 to 25,000 genes, less than carrots do. What they've realized is, like, in every cell in your body, you have genes from your mother and your father, and half of them are silenced. More than half of them are silenced. And so one of the genes that we know a lot about is one called ApoE. And the ApoE genes have been associated with cardiovascular disease and with Alzheimer's disease. And they come in 4 different types. And the ApoE4 gene has been associated with really high risk to cardiovascular disease and strokes and Alzheimer's. And the Alzheimer's is especially high when people also have cold sores or chronic herpes infections of some sort. So there are some genes that have really specific information, and knowing your genetics can be really useful. But even more important is understanding kind of how plastic our genes really are, and that when we get enough sleep, and when we exercise, and when we have fun, and when we eat colorful foods, um, and we're not stressed out, like, all those lifestyle things really help the genes regulate and be happier and healthier and less angry. I'll just tell, like, a short paper that I really love. Dean Ornish, maybe 10, 15 years ago, did a study with men who had slow growing prostate cancer. And he put them all on the Dean Ornish program, which is a mostly vegetarian diet with about an hour a day of walking and some fish oil and some antioxidants and some group counseling and some yoga, right? So this is kind of the Dean Ornish plan. And in 12 weeks, they measured in some of them gene expression. And what they found was that over 80 different oncogenes were silenced, and over 150 cancer protective genes were turned on, right? So this is the power of kind of lifestyle medicine and doing the right thing for your genes. And now, just in the last few months, Dean Ornish has also published research on his program and how it helps slow down and improve quality of life in people who have early cognitive decline, which is really stage 1 Alzheimer's disease. And then he was also the first person to demonstrate, hey, if you actually do this program, you reverse atherosclerosis. So this is the power of kind of looking at everything systemically. It's because the big things that we do, the little lifestyle changes that we do for diet and sleep and exercise, they have profound effects on just how we feel and our moods. And then they go all the way down to our microbiome and our gene expression. And it's really exciting because when we start looking at kind of as above, so below, it really works. And it's kind of thrilling. And, we don't have to work with people to change everything all at once. All these things are overwhelming. People are so attached to food and so attached to not getting enough sleep or not getting enough exercise. And so even if we just kind of nudge people with one thing, and if you have a coach in your office, then that coach can be that person who kind of holds their hand and keeps working with them. Or if you have groups in your office, you can have group visits, and these group visits are billable, I think. I know they are for physicians. I don't know if they are for in optometry or not, but just really interesting ways that you can think of, like adding to revenue streams and also helping people optimize their overall health.
Yeah, and they appreciate it because, again, we're lacking that in the whole system. I think we can squeeze in one more, maybe two more questions. Regarding vitamin K, how should it be taken with D3? There's like a balance. Do you have a recommendation on that amount?
I don't. It's in the micrograms. It's in a really small amount. But also just remember that every time you eat a green leafy vegetable, or you have sushi that has nori, or you have a sea vegetable, that every time you eat something green, your microbiome makes vitamin K. Or if you have some kimchi or sauerkraut, or you eat yogurt or any kind of cultured or fermented food, or even cheese, your body's going to make more vitamin K.
Yes.
So thinking about it from both levels, the supplement, but also how can we get it that our body will actually make it.
Yes, that's a great. And talking about leaky gut and improving vitamin absorption. I mean, that's a very long conversation. Any insight on that though? Vitamin absorption with microbiome issues or leaky gut issues?
Yeah, so I would start even a little bit further up. A lot of us, as we age, especially, or when we're under a lot of stress, our stomach acid levels go down, and that stomach acid is used to help us to digest protein and break it down into smaller peptide units so that we can digest it more fully. But also that stomach acid protects us against parasites and small intestinal bacterial overgrowth and fungal overgrowth because it kills what hits the stomach acid. And then in terms of absorption, that stomach acid that in the duodenum, which is the beginning of the small intestine, really helps us to absorb calcium and iron. I mean, you probably have heard, take your iron with tomato juice or orange juice, or there's even some orange juice that comes with calcium in it because it helps with the absorption of minerals. And that's true for zinc and potassium and manganese and other minerals as well. So starting a little bit further up with kind of that stomach acid, having people chew their food well helps with digestion because the digestive system doesn't have to work so hard. And then with leaky gut, what happens is that we are sometimes taking nutrients and food molecules, we're taking them in to the bloodstream before they're fully digested and ready to be digested. And the bloodstream can't do that. It's a whole nother lecture, but the bloodstream really can't do that. And so what happens is we start getting immune system reaction in the bloodstream from food that we've eaten because the microbes from the food come in, the microplastics come in, the food additives come in. And because with leaky gut, the small intestines lost that kind of dual function that it has. Its job is to let fully processed nutrients into the bloodstream and other phytonutrients and cofactors, and they can come into the bloodstream, but keep everything else in the intestines so that they go out with our poo. And when we've got leaky gut, then we lose that discernment. The small intestine loses its discernment, and we start getting food sensitivities and skin reactions and allergies and other issues, migraine headaches and other issues.
Yes, there's a lot of connection there and ocular connections as well. So, so that will conclude our questions. If we missed your questions, please feel free to email us directly in our director email at director@ocularnutritionsociety.org. Reach out to Dr. Lipski. She's a wealth of information and she's a phenomenal teacher. She's my teacher too. And just thank you so much for delivering this thoughtful webinar. It's just so in depth and we really need that whole body approach to our eyes. And I'm just so happy that we were able to kind of shed light on some new subject matters or just kind of make some subject matters a bigger emphasis on them, maybe in your clinical setting. So we will have this recorded. We will share our slides. You will receive your CE certificate in the next day or two. The next two sessions are not within the COPE approved section, but I encourage you to stick around because they are things that you can actually use to start implementing everything that we've been talking about. And I really appreciate everything you did for us this evening. And obviously you can stay tuned to Dr. Lipski. But I do really, really appreciate what you do for just healthcare as a whole. And as you said, we don't all have to be nutrition degree physicians. We have to understand a new referral system. You know, we have to understand that there's other supporters out there for our healthcare and our patient care. So I thank you so, so much.
Thank you
So
for having me. It was my pleasure.
I hope maybe again one day, but for now, I will take whatever I can get from you. It was wonderful, wonderful. So this is in kind of a nice bridge to part two. So if you haven't received the wellness supplement guide from our from Review of Optometry, it just came out this week. And going back to the emphasis of what can you do now? What can you do tomorrow? You can ask a few more questions. Perhaps you can beef up a little bit of your medical history form. You can also give something called a Mediterranean guideline to your patients. We created a collaborative effort with the American Nutrition Association. So we put our brains together, OWNS and the ANA, to offer you this patient-friendly downloadable guide or printable. It's technically 2 pages or 1 page front and back. And it's just easy. It's an easy way for you to start this tomorrow where you can give them a recommendation on a nutritional guideline and really say to them, to your patients, that this is something that supports eye health. So at the most minimal thing, this is very easy to use. And yes, there's a lot more than just the Mediterranean guideline in nutrition, but as we said, we need a starting point, and this is an excellent starting point. So I appreciate what the ANA did with us on this guide. You could download it here. It's on our website under free resources, and it's also in our new wellness guide with review of optometry.